to our Legacy Leaders Call and our Healthy Living for the week. We're so excited to have an expert in acne actually here with us tonight. So I want to introduce my friend Carly Ballinger. She is a 12-year licensed esthetician and integrative health practitioner. And I love her story because she said that after years of struggling with her own acne and many failed attempts on harsh prescription medications, I hope she's going to talk a little bit about that from the dermatologist. Carly decided to take her acne into her own hands. And that's when she began to dive deep into treating acne through a holistic approach. Sounds a little bit like what we do at Arbonne. So Carly's lifelong struggle with acne was a catalyst for her opening her skin-inspired acne clinic in 2018. And since then, she and her team have been able to help hundreds of people clear up their acne. If you are listening to this call and you think, oh, I wish my friend was on this call, don't worry, we're recording and we will be able to share Carly's wisdom with everyone. And just so you know a little bit about her personally, when she's not in the treatment room, you can find her with her husband and two little ones, Bo and Lacey. I love that. And their two fur doodles, Stella Girl and Bitty Baby. I love that, Carly, Bitty Baby. So we're very excited to hear from you. And I'd love for you to take it away. And just so you know, everyone, I will be monitoring questions in the chat and we'll get to those at the end after Carly's done sharing with us. So thanks so much, Carly.
Awesome. Thank you. I'm excited to be here. Thank you so much for inviting me. I feel very honored. Also, sorry I had to cancel on everybody last week. I was so bummed. I got sick and really kind of lost my voice. So I figured if I would hop on a call and start talking, I would just like be coughing the whole time. So I'm so sorry. I'm happy to be here. So like she said, I am a licensed esthetician. I've been licensed for 12 years now. I have experience working in day spas, med spas. I also went to school for medical assisting. A couple years after I went to aesthetic school, thinking I would work in the medical field, whether that be plastic surgery, dermatology. That was kind of the route I was thinking I wanted to be in. And that's where I learned a lot about the medical system and just the Western medicine way of treating acne. And that's where a lot of my personal experience stems from, as I was one of those people who was literally on every medication possible. I was struggling with my skin then, and even though I was an esthetician, not a lot of estheticians really knew what to do with acne. That's not something that you necessarily learn in aesthetic school. You just kind of learn the basics of like doing a regular fluffy facial, if you will, relaxation facial, and then also just like learning how to be sterile and pass state boards. So treating acne is definitely just extra education that was necessary if that's something that you wanted to like niche down in. So like I said, I worked at the dermatology office and I was on all the medications. I actually worked in Mohs surgery, which is funny. I didn't really work in the aesthetics field in dermatology. I worked in skin cancer removal surgery, which was really awesome. I loved it. And then the esthetician in that doctor's office just kind of up and quit in the middle of the day. And they were like, Carly, we know that you have your aesthetics license. And so I got kind of thrown back into it, which I was really happy about because I realized I really love doing this stuff. But the surgeon that I worked under was the one kind of like handing me medication like it was candy. One thing wouldn't work, I would move on to the next. So I've been on antibiotics. I've been on all of the prescription topicals you can think of. And that was, like 8 to 10 years ago. So there's a lot more medications out there. Some people will walk into my clinic with a new medication. I'm like, what is this now? But I was on all the topicals. I was on antibiotics. I was put on spironolactone. And my last resort was Accutane. So I have been on Accutane. It cleared my acne. So I was on it for 6 months and then it cleared my acne for about 6 months. And then my acne just started coming back with a vengeance. And at that point in time, I was just at a hard no with any other medications. I knew the side effects. I personally experienced a lot of side effects. I had major mood swings with it because you have to be on birth control at the same time. I was on other medications at the time too. But so if you are like more prone to depression or anxiety, you are more prone to like getting stronger effects when you're on Accutane. So I struggled with that. I struggled with muscle and joint pain, and then I struggled with some major gut issues, which I still struggle with today. So my husband and I were also engaged to be married at the time, which meant I knew we wanted to have kids pretty soon after getting married. And if you know anything about Accutane, you know that you have to be very careful. You can have birth defects when it comes to being on acne and getting or Accutane and getting pregnant. So I just was kind of like, I don't want to do this again. And that's when I kind of decided to just take matters into my own hands. I'd already been doing my research into acne programs. I was being mindful of nutrition. And then that's when I discovered Face Reality Skincare, which is one of our main skincare lines that I utilize in my clinic. I am one of their top accounts. We order their products a lot. We utilize their protocols a lot. And I really believe in the brand, and they have a certification program that me and all of my employees have been through. Um, and then I also have been through other like nutrition and stuff, nutrition education certifications and stuff. But in the past year, in 2024, I also completed an integrative health program. So after working with clients for so long that are struggling with acne the past few years, I've just learned that acne is so multifaceted. It's a skin condition that most people are struggling with this day and age. And most of the time it's stemming from internal issues. So I was trying to treat acne with just a topical approach for so long, and for most people, it wasn't working. We try to say, or Face Reality, the line that I'm certified through, will tell you that we have a 90% success rate. And I was just like, that's not the case. We cannot heal people with just topicals, treatments, chemical peels, stuff like that, because most of the time it's internal. It's not a topical problem, is what I tell a lot of my clients. Every single one of the things that we've been utilizing is kind of what I call like a band-aid approach. So whether that be your treatments or the products that you're using at home, those are all band-aid approaches. And we're not just getting to the root of the problem. So at my clinic, we've been able to help people just discover specific triggers, whether that be your diet, your lifestyle, or maybe your products, but we really dig into that and help them. Something that I always like to tell my clients too is there is no cure for acne, unfortunately, but we can keep it under control, and we have the right tools to do that. So majority of the root causes that I do find, and something that you guys will enjoy learning about, is poor gut health, liver toxicity, hormonal imbalances, nutrient deficiencies, chronic stress, and inflammation. So before I get into like some of that, that's kind of what I wanted to focus on this call, because obviously we are all passionate about gut health. But I just wanted to kind of share a crazy statistic, and I have it here on my phone, so I'm going to share it. The acne affects 70 million people just in the US. And I think that's so wild. And this is also just the people that are reported. So sadly, less than 15% of acne sufferers are not seeking professional assistance. Of course, there can be barriers, access to finances, stuff like that. I have some people, unfortunately, my clinic, we are all estheticians. We are not a medical setting. We cannot collect any insurance or anything like that. So it is a pretty penny to get treatment or to work with a functional medicine doctor. Appropriate ways to treat acne would be that way, but unfortunately a lot of people do have to utilize that Western medicine approach and just get products that are covered by insurance. So what is acne? Ultimately, acne is a genetic condition. We call it retention hyperkeratosis. And so one thing that I always tell my clients when we do a new client acne consultation, I always, always, always remind my client that it takes 90 days for a breakout to even surface the skin. So it's so, so important. And I'm sure you guys have had this, when clients are starting their greens or doing the gut reset or doing the 90 days to health, or I'm sorry, 30 days to healthy living. It's important to understand that it takes time. Our skin is a living organ. It is our largest organ and it is an exit organ. And so, especially when I put them on a new skincare routine, a lot of people, this day and age, we live in just a very instant gratification world. So, people want to see results like yesterday. Especially like, I mean, we're girls. We're so excited to get a new skincare routine. We want to see our skin look like, they call it the glass skin these days. And people just want to see the results instantly. And you cannot expect that, especially when we're treating acne with a holistic approach. So one thing I also remind my clients is a normal skin cell sheds about up to one layer of skin a day, of dead skin. When we are acne prone, our skin cells are just not working properly, and we shed up to 5 layers a day. So ordinarily, these dead skin cells are pushed from behind, newer cells rising to the skin surface, and then they flake off normally. That's a healthy pore. But unfortunately, acne prone produces up to 5 dead skin cells a day, and these excess cells just stay stuck in the surface and clog the pores. With that being said, because of the 90-day cycle of a breakout, I could be looking at a client at their consult today and they could have a breakout underneath the skin that hasn't surfaced yet, but it's already developed. It's a microcomedone under the skin, and it may pop out in a couple of weeks, especially when we introduce new supplements or new topical products, or we eliminate certain foods or what have you, just to kind of see what could be triggering. That may surface quicker. So that's what we call a purging phase. It stinks. My clients hate it. I have to do a lot of hand holding during that phase. But what that is when we introduce those new things or we eliminate things, your skin purges, it's going to push those breakouts. It's going to make them surface quicker than that 90-day cycle. Which I celebrated. I'm like, heck yeah, like get it all out. Let's move and groove and get those skin cells moving properly. Because as acne prone clients, we do need a little bit more exfoliation. So when we do exfoliate a little bit more, you're just going to shed a lot more skin cells. So it's just important to hold people's hands and just let them know that, because a lot of people want to give up. One of the most common skincare mistakes I see when treating acne is trying to treat it too late, after it has erupted. So often people get hung up on trying to fix already what they see in the mirror, right? But what we want to do is try to treat the condition before it's developed. And that's what comes to, getting to the deeper issue and finding the root cause of their breakouts. Sorry, I have notes. So, okay, so I want to get into the gut skin axis because that's kind of what we focus on as Arbonne consultants, with our health supplements. And I just decided to focus on this more because I only have so much time. Maybe some other time we can kind of get more into like the topical skincare products, but I'm very passionate about treating from the inside out. So I have a podcast. It's called From the Skin Side Out. So if you ever want to learn more just about skincare in general, I have a podcast with another esthetician. She's one of my good friends, and it's really informative. So since I began treating acne with more of a holistic approach, there are 2 areas of nutrition or common acne triggers that I find often. So one thing is I like to call the glycemic load. Glycemic index, high-low glycemic diet, lots of ways to phrase it, but I feel like this is probably one of the biggest areas of nutrition that can affect acne. So basically, the glycemic index is just a system of measuring how fast a specific food affects your blood sugar. So the index ranges from 0 to 100. And the higher the glycemic index, say we're looking at a GI score of 100, that means it may make you more prone to acne, inflammation, other inflammatory conditions. So there are also foods with 0 glycemic index, and there are foods that do not have carbohydrates. So basically, your proteins, your fats, eggs, meat, fish, nuts. High glycemic foods, on the other hand, which would be a score of 70 and above. And that's something I definitely recommend looking into, especially when you're dealing with clients with gut health and stuff like that, is just kind of doing a little research on the glycemic index. But basically, your high glycemic foods are like pure sugar, heavily processed foods, breads, refined grains, those kinds of foods. And one of the reasons why I think that glycemic index or GI is so interesting and powerful is because it can affect so many systems within our body. It can affect blood sugar, hormones, it can affect inflammation, and then worst of all, it's a lot of this, whether it's affecting our hormones or our blood sugar, is spiking oil production. So when we are acne prone, anything that's affecting oil production, or I'm sorry, anything that's affecting our hormones or anything like that is going to spike our oil production. Um, Foods that have high glycemic index are quickly broken down by the body, and this causes a rapid spike in our blood sugar levels. So when that spikes, it leads to inflammation, increased oil production. It plays a major role in acne production. Um, Also, high GI foods affect our hormones, and this can trigger an enzyme process called 5 alpha reductase. It's a tongue twister. Um, so basically, this is giving us those deep acne, cystic acne in the hair follicles. I usually see it, I call it kind of like that chin strap acne. It's down in the chin, it's in the jawline. A lot of people blame it on their hormones. So I get clients that come in all the time and they're like, I have hormonal acne. There is no such thing as hormonal acne. What is affecting your hormones? So that is important to understand that like there's no such thing. We do have acne types we call, inflamed acne, non-comeded, or I'm sorry, non-inflamed acne. There's acne rosacea. We do have different subtypes that we like to label. There's no real terminology for it, but hormonal acne is not one. That's when we're like, okay, well, what's affecting your hormones to cause this acne on the chin? Sometimes we see it on the neck. I also notice a lot when people just don't have good detoxification, or their lymphatic system is not working properly. I see it in this area, so I tell clients we do lymphatic massages and stuff, or some dry brushing or gua sha massage to get that lymphatic system moving and flush out those toxins. Um, but unfortunately, in the world that we live in today, most people were raised on these foods, and it's just getting worse and worse, as you all know. I know for me personally, like when we were, younger, we would start the day with a bowl of cereal or eat a Pop Tart, or like my brothers and I always laugh now because like we were all athletes, and we'd take our Gatorade to our sporting event, and that would be what we would hydrate with. Or like starting the day with a big glass of orange juice. So a lot of people are just starting their day with sugar and carbs. And then it's the same way, unfortunately, now. Um, I have clients coming in ages ranging from 9 years old to, all the way in their 40s and 50s, sometimes 60s, clients that are struggling with acne. And that's because of the toxic load, truly. Um, the processed foods, the toxins in the air, just, you walk outside and you're dealing with toxins. So I always have clients come in too now, and I mostly women. I am mostly a female clinic, unless we do have a lot of teen boys, but not a lot of men coming in. But we have to understand too that men have basically one hormone, right? They have testosterone, and that kind of levels out a little bit, whereas women, our hormones are all over the place, and a lot more can affect, our hormones and our cycle. But I hear all the time, I never had acne when I was younger. I never dealt with this as a teenager, and now I'm all of a sudden dealing with it. And it's just unfortunate, as we all know, the world is just becoming more and more toxic. The foods that we're eating are just worse and worse for us. Even medications we're on, and we're over supplementing and not properly supplementing without specific like blood work or testing. We're just kind of self-prescribing. So a lot of people are struggling with their skin this day and age because we truly aren't nourishing our bodies the way that our ancestors did. I say that all the time. Our ancestors were eating more whole foods. They were growing their foods and just making their meals at home. They got their milk straight from the cow tit, and it was just a lot healthier back then. So, and nothing wrong with the occasional like donut or what have you, but something I always am I always try to get into my client's head is like the just the proper nutrition and the importance of like even just starting your day with a high protein meal. Stop drinking coffee first thing in the morning and spiking your blood sugar and spiking your cortisol, because as we know, stress can affect so many things and cause inflammation as well. So I really tell them to prioritize breakfast. Something I talk about with them is just kind of set up your day for success and not failure. Um, and overall, just breakfast is the first thing, hitting your system in the morning. And then the second food that I would address when it comes to like gut health and the link between our gut and our skin, a common trigger is dairy. And I know a lot of you have probably heard this before. I know especially we're all Arbonne consultants in general, and we all love that it's dairy free. We love our pea protein. That is one product that I recommend to a ton of my clients. So if you have anybody who is curious about our protein, I highly recommend, getting them on the pea protein, especially if they're struggling with their skin and not just acne, but also like rosacea, eczema, any inflammatory skin condition. Even if they're struggling with like some like body, dermatitis or what have you, most of the time whey protein is just not digestible for a lot of people, and the pea protein is just a better alternative. So when we're eating too much whey protein or eating too much dairy in general, um, it's just going to spike our blood sugar as well, and it also will spike testosterone. So just something to keep in mind when you're recommending products for someone who is acne prone and looking for some help with that. Um, so milk does not cause acne because it's high GI. It's actually a lower glycemic index, what I was talking about. But we do know that drinking cow's milk may be linked to an increase in breakouts. And, there's not many studies out, which is unfortunate because there are more coming out, and I won't get all into all of that. I nerd out and I like to read the research. I believe there needs to be more research on it because, in my opinion, acne is just a super debilitating skin condition and can lead to like major anxiety, depression. I have had hard conversations with people. I've seen a lot of people cry over their skin. It's very debilitating. So I wish more and more research would come out, but that's just the way that it is. Um, so one theory is that certain foods are pro-inflammatory, and milk may be one of them. So it's known that milk can actually worsen inflammatory skin conditions like eczema, psoriasis, and also acne. And then there's also the conversation about the hormones, obviously. So artificial growth hormones are given to some cows to boost their milk production. Organic milk is produced by cows that are not given added hormones, but all cows do produce their own hormones. So it's possible that just consuming the hormones from the cow itself can also affect your natural hormonal balance. Another potential theory is that the idea of IGF-1, which is the insulin-like growth factor 1, cows do produce. So humans also produce this hormone. During puberty, we produce this hormone, and it is known to contribute to acne. Um, so yeah, I'm assuming I'm like running right on time, hopefully. I don't know how long I've been talking at this point, but I wanted to leave room for questions as well. Also, thank you again for having me. And yeah, I'm super passionate about this. Like I said, I have a podcast called From the Skin Side Out, and I'm also on Instagram. I'm under Skinspired by Carly, and I do post a lot about skincare, gut health, and also Arbonne. I've been loving being a part of the Arbonne team, and it's just been so nice to not only like incorporate the Arbonne products into my clients. We always have these conversations about gut health, so it's been really nice and just really aligned. The brand aligns with what I'm already teaching people. And then yeah, maybe some other time we can kind of get more into like the topicals and products that I may recommend from Arbonne.
Yeah, that's really cool. Can we ask a couple questions? One,
Yes, I haven't been able to
I
look
have
at this.
that's okay. I have a curious question because I really hear from a lot of people that green synergy has helped. Like they start drinking green synergy, they see a difference. Obviously, I feel that it's a gut skin connection, but will you talk a little bit about
Yeah.
that product in particular?
Yeah, I would say Green Synergy is one of my most recommended supplements to acne clients, aside from um, the protein, especially if clients aren't getting enough protein in their actual diet. Like it's a great recommendation. But so I love that Green Synergy has pre and probiotics in it, for one. As an integrative health practitioner, I am able to run HTMA hair scans on clients, which is um, helps read what like vitamins and minerals. It's a hair tissue mineral analysis where I pull someone's hair. Um, it tells me what vitamins and minerals they may be deficient in. And it also just tells me what systems in their body just need the most work and what we need to really hone in on. And most of the time, it's protein synthesis. They're not getting enough protein or they're not digesting their protein properly. So that's where the digestive enzymes go into place too. Most women, I feel like we all need digestive enzymes to
Hmm.
help break down our food because of hormones. So I love it for that as well. The pre and probiotics, we already recommend probiotics to our clients. Think of it like an antibiotic. The dermatologist or maybe the OB or whoever, the doctor may prescribe someone an antibiotic. I call that the Band-Aid approach. We're just going to put someone on an antibiotic and we're just going to flush out all of the, bad bugs and bad bacteria, but also the good bacteria.
Hmm.
And there are studies out that say that an acne sufferer does have a little bit more bad bacteria in their body. And again, we don't know what that's from. It could be the gut health that we just don't know. So you don't necessarily need to just like wipe everything out. So we just treat it as let's get some probiotics into the system and see if that kind of balances things out. So I love Green Synergy for pre and probiotics. I love the digestive enzymes. I also love that they're collagen builders. So I love that it's building off of our natural collagen,
Hmm.
and not just like regular collagen that probably won't really get to your skin. There's just some crappy collagen supplements out there, so I love that we have the builders. And then hyaluronic acid is great too because most of the time clients with acne, they're very dry. So hyaluronic acid is a great hydrating supplement, whether you're putting it on topically or internally. Our bodies naturally produce that, and as we age, or as we have certain deficiencies and stuff, we don't produce as much. So I love that just for dehydration purposes. Um, like I said, most people who are acne prone just have really dry skin, especially because they're just trying to dry things out, which is not, that's
Right.
how I used to do it. I used to like hop
Yep.
in tanning beds and put toothpaste on my breakouts. Like my bless my
Right.
mom's heart, like we would just do everything to just dry my face out. And now we just know that that's not the proper way to treat skin. We need to nourish the barrier because if your skin is constantly dry, you need hydration, you need nourishment. If it's constantly dry, it's just a breeding ground for bacteria.
Yeah, that's really good. That's something that, I learned actually through my Arbonne journey was like, oh, your skin is just, when you're trying to dry it out like that, it's just going to produce more oil.
Yes, the
We do have a
inflammation is
couple.
just okay.
Oh, sorry. Yeah, we do have a couple questions in the chat, so I want to get to those. And then, gosh, Carly, you just have so much knowledge. We'd love to invite you
Oh,
back
thank you.
sometime. So, Brenda asked if acne scars can be treated so that they fade. Acne scars. Can you treat acne scarring?
Yeah. Yeah. Of course. So the ways that we treat acne, we of course wanted to clear the acne first, especially if we're like here in my clinic, we utilize like ProCell microchanneling, which is ultimately like microneedling. I'm not sure if you guys are familiar with that, but microneedling, we utilize little tiny needles and it creates little pinpoint wounds in the skin. And that just kind of wakes your skin up like, oh, hey, I have this wound and now I need to heal it myself. So I love that treatment for like more pitted scarring. But when
Hmm.
it comes to like, it depends on the scarring. A lot of people going back into like people trying to dry out their acne. A lot of scarring, hopefully we're getting it under control before it starts to get like into that deeper, like ice pick pitted scarring. So I hope, most people just come in and get professional help before it gets to that point. But most people are dealing with post-inflammatory erythema or post-inflammatory hyperpigmentation. And those are like those annoying little acne marks that you're like, okay, my breakout's gone, but now I have this red mark on my face for another week or two, and that is called erythema, and that's the most common. And what's happening is most people's barriers are just very impaired and their skin is not able to heal. So that's why we get those post-inflammatory erythema marks. So that's again going back into the importance of hydration and not just drying the skin out. I see it a lot with my clients. I get told all the time that I'm the last resort. So clients have gone to the dermatologist, they've been on all of these things and they're like, this tretinoin cream or whatever they've been put on is
Mhm.
just burning their skin to the point where they just don't want to use it. It just hurts. They're like, do I want clear skin or do I want my face to feel like it's falling off? And
Mhm.
so by the time they get to me, they have a lot of redness and inflammation and those post-inflammatory marks. But absolutely, we utilize chemical peels too, very gentle peels. Peels have evolved. It's not like the old school peels. Like, I don't know if you guys have seen Sex in the City. I always think of
Yes.
Samantha from Sex in the City, like with her chemical peel burn. It's not like that anymore. I can bring an acne client in. I like to bring them in every 2 weeks and give them a chemical peel. And most of the time they don't peel. They like, if anything, they have like a light dusting, but peels have evolved so much. Brands know that people don't want the downtime, so it's
Right.
awesome. I love peels. And I'll even do them in the summertime. I just have to make sure my clients are being diligent with sunscreen.
That's cool. That's great. Okay, last question. Best tips for large pores and minimizing them.
Okay, so I'm gonna break some terrible news to you guys, but your pore size is your pore size. It is genetic. Another thing, it's a marketing term when people say that we can like decrease your pore size or make your pores smaller, and also your pores do not open and close. They are not doors, but we can make them appear to be smaller. So if you are someone who has larger pores and if they tend to get clogged, if you're more prone to that like non-inflamed acne, which may be your blackheads, or what we call sebaceous filaments, so that's like congested oil production. We all have sebaceous filaments. I'm sure we've all like pinched our nose and just like squeezed stuff out, and we think that's blackheads. It's actually sebaceous filaments. And that's just like natural in our body. That's never going to go away. So I just recommend utilizing like a scrub once or twice a week, and you just may need a little extra exfoliation. So exfoliation are like your active ingredients that may be, I love mandelic acid, that may be any type of retinol. It may be just any active ingredient, salicylic acid, glycolic acid, just anything that's going to
I think
exfoliate your
genius.
skin.
How about Genius pads? Those come to mind.
The pads, I love those. I have actually a couple of my acne clients on the Genius pads and they're loving them. But yeah, that's exfoliation for you. I don't recommend
Okay.
doing it every single day, because that's how we damage the barrier. That's what some people, need guidance on is
Yeah.
like when to use my skincare products. How often do I exfoliate? And it's different for everybody. So you kind of have to play with that. A lot of people love, their I get it in the treatment room too. They're like, I love the tingle. And I
Right.
get it. Like you feel like something's happening, but also that's not normal and we don't want that. We just want to nourish the skin.
I love that. Well, I wish we lived closer so I could come visit you. And honestly, I wish I could have my daughter come visit you. So we
Oh,
can just go through all the things, but we're super grateful. We're a little over our time, but you're
yes,
such
I'm
a
sorry
wealth
about
of
that.
knowledge. No, it's not you, it's me. I'm like, I want to know this and this and this. So, Carly, maybe you'll come back and visit us again, but thank
Of
you so,
course.
so much. And we are so grateful to have your knowledge and your expertise. So, cheers to healthy living, friends, and have a great night, everybody.